Hello, I'm Dr. Dimitrios Kostopoulos, co-founder of Hands-On Seminars, and I have with us today Dr. Kevin Okamura, Senior Faculty of Hands-On Seminars, founder of the program Certification in Advanced Manipulative Therapy. Let's talk a little bit about that, the Certification in Manipulative Physical Therapy program.
Yeah.
What is different about that program, and when you were developing it, what did you want to give emphasis on?
The challenge with learning any manual therapy techniques, I think, is how technically difficult it is. What I really wanted to emphasize was, first of all, how to perform techniques correctly, but also how to really assess the proper planes of motion. So learning how to manipulate a thoracic spine, for example, is fine, but if you don't know how to find the correct joints to manipulate in the first place, you're kind of flailing in the darkness a little bit. So what I really wanted to do in the program was spend a lot of time going over the biomechanics of the different regions of the spine, how to properly assess and feel for joints that need treatment, how to also assess the safety factors involved with manipulation and make sure that joints that don't need treatment are unnecessarily manipulated. And then I really wanted to kind of perfect and bring people to a real high level of practice and efficiency.
So assessment is extremely important in this case.
Absolutely, yeah. I think that's the biggest thing that I find when I've taught courses in the past. People want to jump right into treating,
right,
to technique. They kind of like the idea, especially with thrust manipulations, of getting in and doing something that's really dramatic. But the emphasis on my perspective is really trying to pull them back and get them to carefully figure out why they're applying this technique in the first place. So especially when it comes to regions like the neck, where there's some more safety considerations, assessment is absolutely crucial.
And the feedback we've been getting from the students who are taking your program is that they feel that after they finish every modules, they feel a tremendous level of confidence in performing the techniques and performing the proper assessment. How do you manage to achieve on the course participants that level of comfort?
I think it's really just starting back with an explanation of the biomechanics. So this is what a joint does. This is the way it can move and this is the way it can glide. So theoretically, a lot of people get that stuff, but then when it comes to feeling it, often that transition from knowledge to
right,
hands is really a tough one for people to make. So I really try to get people feeling properly what it is theoretically they seem to understand. So I'll put my hands on their hands, for example, and try to assist them being able to experience a glide. We'll spend a lot of time with practice and nobody feels rushed. There's ample time for questions and explanations are given. So it's really a comfortably paced, not too slow, but not too fast course that I think really is very thorough in the explanations.
And how about for students either here in the US or even from some other international locations, but who have a degree here in the US, who want to take their board certification, the orthopedic board certification here in the US through the American Board of Physical Therapy Specialties. Is your program helpful to those people?
Absolutely, yeah. I think that if they were to complete the program, they're going to have a fantastic foundation and a real leg up on individuals looking to pursue that path. There should be a real consistency, a real carryover. As I said, everything we're doing is based on these sort of Canadian and international standards, which are also very applicable to everything done here in the United States as well. So I think it would give them a very, very solid starting point for that, and probably an advanced starting point for that, where they'd probably be quite a bit further along than the other people in the program.